My name is Judy Seaman, Artistic Director of the Berkshire Jewish Film Festival. I work with a wonderful group of volunteers. I want to thank Stu Masters, and I want to thank Ed Kolodny for his upcoming presentation. We're really excited to hear from him. I also want to welcome Jeff and Ronette Levinson for making this wonderful film. And I know that everybody really loved it, and we're so glad that you introduced us to this subject.
Last evening, we saw a short documentary about a photographer named Robert Zuckerman, who, despite being confined to a wheelchair, continues to pursue his passion, taking still photographs of ordinary people in their natural settings, revealing their beauty and individual personalities. As we learned in the movie, Life Through a Lens, Robert Zuckerman has a condition called APBD, Adult Onset Polyglucosan Body Disease. Before we begin our Q&A, allow me to tell you a little bit about our very good friend and world-renowned expert, Edwin Kolodny. Dr. Kolodny is a graduate of Harvard College and New York University School of Medicine. He trained in internal medicine at Bellevue Hospital and in neurology at Massachusetts General Hospital. Following a fellowship in neurogenetics at the NIH, he joined the Harvard Medical School faculty. In the early 1970s, Dr. Kolodny teamed up with Dr. Alan Crocker of Boston Children's Hospital to begin the New England Tay-Sachs Disease Prevention Program, eventually testing over 30,000 young people for the Tay-Sachs disease trait. Dr. Kolodny's office and laboratory at the Eunice Kennedy Shriver Center in Waltham, Massachusetts, attracted referrals from many patients with complex genetic disorders. To those of us who are local and know Dr. Kolodny, he is considered the world's expert in Tay-Sachs disease and in Gaucher's disease, and probably in a bunch of others that I don't even know the names of. Dr. Kolodny was called back to NYU in 1991 to chair their Department of Neurology, which became among the top 10 rated neurology programs in the United States. He retired from NYU in 2011, but has continued to serve on many scientific advisory committees for rare genetic diseases, many of which affect Ashkenazi Jews disproportionately. Dr. Kolodny is chair of the Scientific Advisory Board of the APBD Research Foundation, a lay-led organization he helped to start 15 years ago. Dr. Kolodny, could you describe for us what exactly is APBD?
Yes, Stu, but first I have to thank you for that extravagant introduction. Thank you very much. Although Robert Zuckerman, as we heard last night, can no longer walk independently, he has not lost his zest for life, and he expresses it so well through his photographs and written descriptions of his subjects. I enjoyed the film very much, and will tell you at a later point a little bit about how it was made. Now, to answer your question, Stu, APBD is one of about 7,000 rare orphan diseases. An orphan disease is a disorder which affects generally less than 200,000 individuals. But worldwide, there are probably 350 million people who do have an orphan disease. Almost all of the orphan diseases are of some genetic basis. They have a genetic basis. In fact, if you had the New York Times science section to read this morning at breakfast, you would have seen a 3-page description of some unfortunate families with rare orphan diseases. Now, people with APBD have, as I indicated, a genetically determined disorder, which is especially prevalent among Ashkenazi Jewish people. And this is, of course, one of the reasons why we were very pleased to see the story of Robert Zuckerman yesterday to spread the word about APBD. Just let me tell you a bit about the symptoms of APBD. It's an adult onset disorder, so life goes on normally until about age 45 or 50, the fourth or fifth decade, when bladder dysfunction becomes a problem. And that may sometimes be mistaken for, in men, of course, a prostate problem. But then, as we saw with Robert, there's a gait disturbance, and then sensory and motor neuropathy. The nerves don't work well. And pretty soon we have weakness in the legs, and then also weakness in the arms and fatigue. There can be, towards the 60s and later life, a mild cognitive impairment as well in our patients with some memory deficit. And this pattern can be seen as a white matter change on the brain MRI. By the early 60s, the patient requires generally assistance with a cane or a walker, and subsequently they become wheelchair dependent, as Mr. Zuckerman is. And there is a probable median survival till about age 70. So that's the overall picture. We do know a lot more about the disease now than we knew 15 years ago. You want to know, I think, about what causes APBD. It's due to a deficiency of an enzyme known as glycogen branching enzyme. Normally the protein, glycogen branching enzyme protein, is found in all organs and tissues of the body, and it's necessary to put branches onto glycogen, which is the essential and important source of carbohydrate for the body cells and tissues. It forms branches in the glycogen. The enzyme is called glycogen branching enzyme, and among Ashkenazim, there are two common mutations. They are known as so-called Y329S and IVS15. This is technical terminology, but people who are tested, who are Jewish and have the disease normally have two of one of these mutations or one of each of the two mutations. So it's a genetic disorder, and it is handed down as a trait from both parents to the affected individual, affected child.
Does our diet make much of a difference?
Yes, that's a very good question. The diet has a low carbohydrate diet has been tried in patients in order to reduce the amount of glycogen synthesis, the amount of glycogen that goes into the cell. Because once the glycogen is in the nerve or in the muscle or in the brain, nerve cell, it can't be broken down because it's abnormal glycogen. So patients have been tried on low carbohydrate diets, but it has not so far made much of a difference.
How prevalent is APBD?
Another good question. This is hard really to say, and it's really much more common than one would suppose. There are about 200 case reports in the National Library of Medicine of APBD. The APBD Research Foundation has a registry, they sponsor a registry, and about 100 cases have been collected and are in the registry of the APBD Research Foundation, which is maintained at Columbia University. So it's an ultra rare disease, you would think. Now let's look at screening that has been done among Ashkenazim. It turns out that there are 2 studies right now that have shown how frequent the gene appears. And in one study, there was a positive gene trait for APBD in 1 out of every 35 people screened. And in another study, it was 1 out of 48. Now, if you translate these using the so-called Hardy-Weinberg equation, you get a incidence of births of between 1 in 4,800 to 1 in 9,000 Ashkenazim. So theoretically, about 1 in 6,000, shall we say, Ashkenazi Jews should be born or are born with APBD.
If the birth incidence is as high as these studies suggest, why don't we see more cases of APBD?
Excellent question. Excellent question. Thank you. The reason is, there are several reasons. One reason is that it's rare at the moment. It's not taught in medical school, and physicians and healthcare workers don't know about it. But probably the most important reason is it's misdiagnosed as ALS, hereditary spastic paraparesis, but the most common misdiagnosis is multiple sclerosis. And if you go into a clinic of people with multiple sclerosis, you find that there is a proportion, probably 2 to 5%, who don't have multiple sclerosis, but have APBD. And it may take 6 to 8 years of a diagnostic journey for these people to wind up with the right diagnosis. Larry Schwartz has published a paper which just came out this month in the Journal of Rare Diseases, in which he estimates the prevalence in the United States between 3,400 and 6,300 patients affected with APBD. We only know about 100.
If there's incorrect diagnosis, does that lead to possibly harmful therapies for the people who are misdiagnosed?
Yes, exactly. They may get very expensive drugs to treat their, quotes, multiple sclerosis, only to discover that it does no good and the neurodegeneration continues. But sooner or later, some physicians who have had experience with APBD come on the scene and get them to get tested and get them into a different clinic.
Would it be worth sharing some of the symptoms of APBD that are different from ALS symptoms?
Well, the first and most prominent symptom is the loss of control of bladder and bowel functions. And that isn't always a first sign in multiple sclerosis. Another telltale sign, which was the case in Robert Zuckerman's case, and in other cases, was that the white matter change that occurs is symmetrical on the 2 sides. And that's very unusual for multiple sclerosis. So it gives more, it suggests more a likelihood of a genetically determined white matter disease, leukodystrophy, rather than multiple sclerosis, which is usually very asymmetrical.
How do you test for APBD?
In the old days, before we knew what the mutations were, we would have to do a biopsy or and look under the microscope at a peripheral nerve for the glycogen deposits, the polyglucosan bodies. And so that required a cerebral nerve biopsy with a loss of sensation in the cerebral nerve distant to that, and then an examination under the microscope. The MRI was helpful because of the white matter change, and also the neurophysiology, where because of the neuropathy, nerve conductions changed, and the neurophysiologist might have suspected a genetically determined neuropathy, of which APBD is one of those. So these were the ways to test in the good old days. Now that we know the mutations, a blood test or even a saliva test is probably all that's needed to see whether the individual has one of the or both of the mutations that are common among Ashkenazi Jews. Now, non-Jews may have a rare mutation in the GBE1 gene. That's what we call it, the glycogen branching enzyme 1 gene. And that would require a sequencing of the GBE1 gene in a non-Jewish individual who may not have the typical Ashkenazi Jewish mutations. But one way or another, you can do it now by gene sequencing or by mutation analysis.
Could you compare ALS versus APBD?
Well, ALS is primarily a motor neuron disorder where muscle fasciculations are an early sign, and the weakness may appear in the hands or even in the face or swallowing, and not always in the legs. But in a typical hereditary neuropathy, it's distal to proximal. So usually, as in APBD, it would be the legs affected first. That's not always the case in ALS. The other point is in ALS, the loss of motor power is rapid, and the course is usually only over a period of 3 to 5 years. APBD, the course can be 15 to 20 years.
Do you expect that identifying risk factors, in this case, particularly Ashkenazi heritage, is that likely going to lead to incorporating APBD testing when somebody's being looked at for MS and ALS?
Excellent question. Thank you for whoever it was that submitted that question, because it's now something that the APBD Research Foundation is working on. There is an Ashkenazi Jewish panel that some of the commercial companies and hospitals with the capability, like the Mount Sinai Medical Center in New York City, where they will look for a host of gene difficulties that you might expect in the Ashkenazi Jewish population. The commercial labs are not, for the most part, things like places like Quest, LabCorp, Roche, and so on. All the commercial labs are just now being approached and asked whether they can be involved in testing for it as well. There may be a financial barrier, though, because they want an awful lot of money to test for one gene or mutations in one gene. So the Research Foundation is doing their best to educate the commercial labs so that we can test large numbers of people.
Can the gene be transmitted from either parent?
Of course, it's not on the X or Y chromosome. It's on what we call an autosomal chromosome, and therefore both men and women are equally suspect to be carrying a mutation for APBD. But both parents have to pass along their abnormal mutated gene to a offspring. So that means that if you are a couple at risk to having a child with APBD, you still have a chance, a 3 in 4 chance of having a normal child. Now, if you have a child with APBD who is asymptomatic because you did testing before they showed symptoms, we've got a real problem. And at this point, I would not, considering the accomplishments of somebody like Robert Zuckerman, I myself personally would not want to be involved in prenatal testing for APBD. But that's a personal opinion.
Is the cerebellum affected clinically? And is there any treatment now or on the horizon?
There is no treatment, and there is nothing that will, at this point, cause the polyglucosan bodies to be removed from the tissues. They continue to accumulate and lead to more pathology. But the APBD Research Foundation has been very successful at raising funds from patients, their families, from interested outside individuals, and they've fostered scientists and awarded grants to study the biology of the polyglucosan bodies. The progress to date has been remarkable. It's in my lifetime, which is with APBD, it's 15 years since the foundation was started. The foundation now has 2 animal models, one for each of the 2 mutations common in Ashkenazim, which have been shared by the researchers at Columbia University with other laboratories all over the world. Drugs have been looked at for repurposing. In other words, approved drugs to shorten the approval time have been tested on fibroblasts, on cells taken from the skin of patients with APBD, and examined for their ability to remove the glycogen or to prevent the glycogen, the abnormal glycogen storage. And some of these compounds, of which there are at least 10 to 20,000, have proven in the laboratory to be very promising. One compound, guaiacol, is actually at the stage in Israel where the Israeli public would like, with APBD, would like to initiate clinical trials. But clinical trials are very expensive, and they yet don't have the funds to inaugurate the trial. There are other compounds which are in the works, which funded investigators have come up with. And then we have one lab that's doing gene therapy studies as well. So there's, on the horizon, there's potential for a treatment, but we don't have it yet.
If two siblings have the collected telltale symptoms, is that a flag to test for APBD?
Two siblings, it's in our experience not unheard of. We have families where there's even 3 affected siblings. It's the luck of the draw. Genetics and having babies is a lottery, as we see in today's New York Times. You can luck out, as most of us do, but some of us are the product of an unfortunate genetic inheritance from our family.
Are there policies at the Shriver Center or elsewhere on whether the medical staff can or should discuss or recommend pregnancy termination?
Diseases such as infantile Tay-Sachs disease, or Niemann-Pick disease, or Bloom syndrome, or mucolipidosis 4, or a number of childhood disorders where an individual will pass away and for which there's no treatment at the present time. Those are indications for prenatal diagnosis. The ethicists at the moment are not enthusiastic about doing prenatal diagnosis for an adult onset disease or for a disorder where there's a treatment. An example would be Gaucher disease, where we have an effective treatment for most cases of Gaucher disease, and therefore the prospect for prenatal diagnosis, really should not be raised. There are consensus reports from the American Academy of Obstetrics and Gynecology for Canavan's disease and Tay-Sachs disease, both of which are fatal in infancy. And there have been lawsuits because physicians who were asked to test for those 2 diseases before or during pregnancy and refused were then found to have patients with these conditions. So the OBGYN consensus reports are a major factor in medical practice today, but there is no consensus report for APBD or for many, many other rare adult onset disorders.
Realizing how expensive it is to to get the drug companies to work on something like this without more funding, is there any sense of how long it might take before there's some way to slow the disease?
The APBD Research Foundation last week held a large international conference on what we call biomarkers, compounds or other means, including neuroimaging, that might be useful in the monitoring of any future treatment, because this is what the NIH requires, and this is what a clinical trial requires. You have to have a marker. So far, the only marker we have is the polyglucosan body, which is inside the tissue and not very easy to examine. But in the coming year, we're hopeful that other biomarkers will be available that will enable clinical trials to proceed with more speedily.
Have you met Robert Zuckerman?
Yes, I've met Robert, and I've had a 2-hour conversation on the telephone with him. He is a remarkable warm-hearted human being. Robert has done some very special things. One of his recent projects has been the interviewing of Holocaust survivors. And he has found the stories of the Holocaust survivors very harrowing and yet very life-affirming. And because of his training as a postgraduate student at Berkeley in film journalism and photojournalism, he's done as well with the pen as with the camera.
He's certainly remarkable, and his positive attitude is just a wonderful model for so many of us, because everybody's got something, but not quite like this. If one sibling has the symptoms and the other does not, is that a clue that it's not APBD?
Well, we have to talk about chronology. Are you speaking about the older sibling being well and the younger sibling having a neurodegenerative condition? In that case, APBD would be something I would think about in the younger sibling, but probably the older sibling might, because of phenotype is identical to genotype, as we say in genetics, we would have expected the older person to also have the disorder, have signs and symptoms, if he had the disorder that his younger brother or sister had. So, but there are families where uncles, aunts, other relatives have had the condition, and then also the offspring of a close relative also develops the disorder. So in a family, it's not unusual to have more than one affected individual. Remember, though, that we as a Jewish people have Ashkenazi Jews have a very small gene pool. From 650 to the present, we are all descendants of probably 50 to 100,000 people left after the Helsinki massacre by the Cossacks.
This is amazing information, and we're so grateful to you, Dr. Kolodny, for sharing this with us. If anybody would like to make donations towards APBD research, the website is apbdrf.org. And I think the host, Judy, is going to send that out to everyone. Ed, before we go, how did this documentary movie come about?
The movie is the work of two very talented people, Jeff Levinson and his daughter, Ronette. Jeff is a dentist and has an experience with APBD in his family, and is now currently the co-president of the Research Foundation. And Ronette is a very experienced actor and has 40 videos to her credit. She's also a musical, she also composed all the music for the documentary, and has many theater credits as well. The work was done between 2015 and 2017, I believe, with a videographer and several other people who assisted in making the video. As Jeff has said, editing it down from the original to 11 minutes was almost impossible, but he did it. And I have to thank Jeff for all the work he's doing today. He's more a scientist now than a dentist, but he's a wonderful dentist too.
Before we close, if there are any other questions, we're going to close this out in just a couple of minutes. I think we're getting towards the 45-minute time, and it's hard to stay on a Zoom for too long. We definitely want to give a special thank you to the Berkshire Jewish Film Festival for making this film available as a public service, alerting us all to a genetic condition for which we hope a solution will be found that will improve the lives of people like Robert Zuckerman and others. Ed, if anybody has additional questions after this, is there a way that they could send them on to you, or should we forward them?
Absolutely. They could send them to our host, and she has my email address and can forward them to me.
Thank you. Thank you all.
Thank you, Judy.
Thank you also very much for joining us. And the film festival is off to such a wonderful, lovely start. Thank you, Judy Seaman and Steve and the rest of the crew. We look forward to seeing you all again on the next Zoom.